So I'm now joined by virologist from Lancaster University, Dr. Mohammed Munir. Mohammed, the results are looking positive, aren't they? Can we expect a vaccine in the near future?
Well, at the moment, all the information we have is really through the press release and some information through other channels. I think the important thing for me as a researcher is to look into the data before we can really exploit all the information in there. However, this is the first stage, which probably is very anticipated, because any vaccine you will use will certainly induce the antibodies and some sort of T-cell responses, which are adoptive part of the immune system. But the real challenge is really into the phase 3 trial, when we will see that these antibodies and the immune system that is elicited would protect the person against the natural infection. That is the real challenge, and that is only coming through the phase 3 trial, which is ongoing certainly and will become available hopefully through the end of November. And by that time, we will be able to really demonstrate whether it has a protective enough to really roll into the market.
Protective enough, and of course for how long it could be protective for, because obviously there are questions about perhaps the vaccine not lasting, maybe more than a year.
Oh, absolutely. That is one of the major concerns, that if the antibodies those are elicited in the beginning, they might be neutralizing enough, but as the time passes, they will probably run out. But that is the thing that I noticed in the press release from the Oxford University, that it induces the T cells, and T cells are important part of the immune system. They take up the virus-infected cells and also give the alarm message to other cells so that they can start producing antibodies. So you can put an analogy of like these are the factories of the antibodies. So if the antibodies would go off, these factories, if they sense the reinfection, they would produce more antibodies. So that is really good news. But again, this needs to be tested before we can claim any benefit.
And of course, tested on human beings. So what happens in these trials? Can you explain what the phases are?
Yeah, absolutely. There are 3 phases before the vaccine could be looked by the regulators for approval to be applied in the field. The first stage is really looking onto the safety. So you define 2 or 3 doses, inoculate into the healthy volunteers and see if that can cause any adverse effect. If that doesn't, then you take this one to phase 2, where the larger group is selected in, say, 700, 800. But based on that information, you are certain that certain dose is effective and then it doesn't have any safety concerns. Then you roll into phase 3. That is the stage where the Oxford University vaccine is, and there are 2 additional vaccines though at this stage. This is the last stage, phase 3, before it go into the regulatory processes. So in phase 3, you divide the group into 2 different compartments. One is a placebo group, where you just inoculate the mock version, and then the other group is the vaccine itself. People who are participating, they don't know who is inoculated with what, and then you ask them to go into the routine life and see if you contract the infection or not. So that is again really the lengthiest process in throughout the regulatory phase 1, 2, and 3 process, because depending on this disease into the population, this time will be decided whether they contracted the infection or not. So after that point, we will be able to see the immune responses that is induced in phase 1 trial, would that be protective against the natural infection or not.
Dr. Mohammed Munir, thank you very much for joining us live here on RT UK.
Okay.